Women's Wellness Authority is your go-to podcast for discovering the hidden gems of holistic health and well-being. In each episode, we dive deep into the many layers of wellness, from mental and physical health to spiritual growth. Through insightful interviews with experts, healers, and thought leaders, we uncover alternative approaches, healing practices, and fresh perspectives that empower you to transform your life. Whether you're seeking innovative ways to heal your body, your mind, or nourish your soul, this podcast offers practical tools and wisdom to help you thrive in all areas of your life. Let's rewrite the rules of wellness together. Step into your power, reclaim your health, and discover what it means to truly thrive from the inside out. All right. Welcome to another episode of Women's Wellness Authority, where we dive deep into the many layers of wellness through insightful interviews with experts to uncover alternative approaches and fresh perspectives that empower you to transform your life. Today, we're shedding light on a hidden but yet powerful disruptor of well-being, and that's mold. In this episode, we'll unpack what mold really is, dispel some of the most common myths, dive into symptoms and health impacts, walk through detox strategies, and most importantly, share how you can take back control of your environment and your health. You may be surprised to learn just how widespread mold exposure is and how profoundly it can influence your health day to day. In today's conversation, I have Dr. Diana Stafford. She is an MD who is board certified and a member of the ISEAI, hopefully I got that right, the International Society for Environmental Acquired Illnesses, who has been in practice for 10 years. She completed her medical training at University of Virginia School of Medicine and residency in Washington, D.C. She works with patients in an integrative and functional medicine approach to achieve optimal health. Not only is Diana an integrative and functional doctor, but she is a mold-literate practitioner who treats mold-related illnesses and other health issues related to environmental exposures. Dr. Diana believes that analyzing the root cause of health problems, not just adding another prescription to briefly subside symptoms, is the true path to health and wellness. So Diana, thank you so much for joining us.
Thank you for having me. I'm excited to be here. So
mold is a topic that I didn't realize really how deep it goes, and there is so much to cover. So I'm just going to jump right in. For everyone that's listening, I thought we'd just start really basic and just defining what mold actually is.
Sounds great. It's a good place to start. So mold is a fungus, and it is everywhere. And it's in the air, mold spores, mold toxins. It's in the soil. It's on surfaces. It is a decomposer. It has a very important role in the ecosystem. It breaks down organic matter like fallen leaves or dead trees, things like that, which is all well and good. But when it's inside, for example, in a water damaged building, or even when there's enough moisture for mold to grow, because it grows very easily pretty much anywhere there's enough moisture and organic material for it to feed on, then whenever it's indoors, it can cause lots of problems for health. So even if you can't see it, it can be there behind walls. It can be there, lurking in the bathroom. It can really be pretty much anywhere there's a humidity around 50% or greater and any kind of organic material to feed on. So it's a fungus. There's, 4 parts of our microbiome, viruses, bacteria, fungus, which is mold and yeast, and parasites. So that's kind of where mold fits in to the ecosystem.
And what do you mean when you say microbiome?
So our microbiome is we are actually composed of more non-human cells than human cells. So in our bodies, there are more like bacteria than there are human cells.
That's so interesting.
It's pretty crazy to think about. But mold is not really supposed to be a huge part of that, but it can get in there and it can disrupt that balance. We do all have some yeast in our bodies, candida mainly, and that is part of that, those different collections of organisms that live on and around us. But mold should not be a big part of our microbiome. It's not a normal colonizer. If it's there colonizing us, it's a problem. So kind of broad overview with lots of different topics that we're never going to delve into more deeply. But
And so is all mold bad? Because you had said mold's a good thing because it decomposes things on Earth, which you want.
yeah, exactly. So no, not all mold is bad. However, in the right situation, mold can be bad for your health. So basically, mold is not a bad word. Some people say, "Oh, we don't want to talk about mold. It's so bad." It's become that for some people, but it's really it depends on the situation. Like some people, of course, are allergic to outdoor molds. But it's not as big of an issue because outdoors, there's such a bigger volume of air into which the mold spores and toxins are going. So it gets diluted. There's this popular phrase, the solution to pollution is dilution. So if it's diluted, there's not a high concentration that you're breathing in, and also air motion. Because inside the air is much more stagnant, but outside the air is constantly moving with more air currents, even though there are air currents inside, but outside there's more. So those are a couple of reasons why indoors mold can be much more of an issue. It does depend on the type of mold, but I do not like to focus on the color of mold versus is it a toxic or non-toxic mold? Because, for example, if someone is sensitive to mold, pretty much any mold can trigger symptoms.
Interesting. So, what are the most common symptoms then of, would you call it mold illness or mold exposure?
Yeah, so you can call it either way, mold exposure or mold illness. Mold causes symptoms via four main mechanisms. There's the allergies. The colonization is where it's actually like on the surfaces of your sinuses or maybe even your gut. The toxicity, which is where these invisible toxins that mold puts off, they can, when we breathe them in or we take them in through food, they actually cross the blood-brain barrier and they also can go into our circulation. So they can pretty much go anywhere. I mean, there is really no limit to where mold toxins can go. So that's toxicity. And then infections. So you can get a fungal infection too from mold. But so my main focuses are on the colonization and the toxicity. So mold illness, we'll just go ahead and talk about as if it's talking about those colonization and toxicity symptoms. So it's pretty complex, but there are a lot of different symptoms that it causes. Basically, any unexplained medical symptom, I say check for mold because mold likes to prey on what you're prone to. If you're prone to gut symptoms, then and you get a mold exposure, then you're much more likely to have worsening gut symptoms if you've been exposed to mold. If you're prone to mental health issues and you get into a mold exposure, mold can aggravate those in a big way. If you are prone to respiratory issues, for sure, mold can cause respiratory issues, which is widely known and accepted even by the regular medical system. But other common symptoms that I see are hormone imbalances, and then neurologic symptoms is a huge one with mold, possibly the most common. Neuro versus gut would be the most common. So brain fog, fatigue, there are, mood swings that I see really often. Any kind of neuro symptom, like nerve pain. The mold, as I mentioned, you breathe in the toxins and they go basically straight to the brain.
Yeah,
So
that's
yeah,
scary.
they cause inflammation. So that's really what's happening as far as a mechanism of action of how mold is causing all of these symptoms, the toxins is inflammation. So it can cause acute symptoms and chronic symptoms. It doesn't just cause an acute illness, but it can also trigger this inflammation. And many times it's not actual mold still in your body, or even sometimes not even toxins still in the body, but it's the residual inflammation. And sometimes you're still getting rid of toxins, but the biggest actual cause of the symptoms when it's chronic is inflammation.
So you were saying symptoms that don't have an explanation. And this, I can use myself as a perfect example. I gained 15, 16 pounds over the last year. Food that I normally ate started really irritating me. I've had hormone imbalances, I should say, for years, and I could not get to the source of problems. Now, I'm like peeling away at an onion, but we just had someone come into our home and clean our vents, and sure enough, there was mold all within our crawl space vents. And so I'm wondering if it's a contributing factor But nobody else in my, well, there are other, some of the symptoms you just mentioned are, my family potentially has. But I could have easily just said, I'm 42. I gained weight because I'm perimenopausal. And that is sort of what I heard from on the traditional medicine side was your weight gains a lot and doesn't make sense. And to me, that wasn't enough of an answer. We'll put you on birth control and your hormones will balance and your weight will readjust. And you're in premenopause and that's just what it's going to be. And to me, that didn't make any sense.
Absolutely. Yeah, I mean, it's so true that many times these symptoms are blamed on just getting older, which I mean, even any age people are getting told that it's just a blanket, like whatever age you are, it can be blamed on getting older, which is sad. Or yeah, perimenopause, things like that. And then you're just kind of left, disappointed, discouraged, and thinking like, is this going to be my life from now on? And is it going to get worse? And what's going to happen? Because it doesn't really get to the root cause. So I am all about that. Yeah, fibromyalgia, chronic fatigue, any of these like syndromes can also be attributable to mold exposure.
So, what I think is interesting, you mentioned before, and maybe this is what I'm observing, mold can affect people differently. So I might have more of a gut sensitivity, but maybe my daughter has more of a neurological sensitivity. So symptoms might show up differently, or then my husband might not be bothered by it at all. Can you explain that a little bit? Because I find that
Yes.
really, really fascinating.
And it's really important for people to hear that and really take that in, because this is another reason why people are gaslit a lot about mold, because in the same family, as you said, there could be one person who's having a lot of gut issues, one person who's having a lot of mental health issues, one person who's having like classic respiratory symptoms, another person who's having urinary symptoms, or everyone could have 10 symptoms and they're all different. So the factors that I see that generally will come together to determine what you're going to get as far as symptoms are going to be genetics. Some genes will affect how you detoxify. There's HLA-DR and MTHFR. Those are two big ones. And if you have certain genetic variations there, then you'll have a harder time getting mold toxins out. And then pre-existing health conditions, and then state of your gut, state of your nervous system. So if, there's been a lot of trauma, because your body does keep the score on that. If a person is like in fight or flight in general, or has a lot of unprocessed trauma, it can affect how you detoxify. And then also, related to the gut, are your detox pathways open? If you're constipated, then toxins will keep recirculating, for example. And then stacked exposures. Like if someone is exposed to mold at home, but then maybe if one person is at home way more than another person and that's where the mold is, then the person who's in the mold exposure for more hours of the day is likely going to have more symptoms.
Interesting. Okay. So I'm sure people are wondering, and we'll get to that in a little bit, but like, okay, so what if I have some of these symptoms, I can't get to the bottom of the answers, some of these things are sort of checking off for me. We'll talk about what they can do and how they can take tests both in their home, in their bodies. But I know there's tons of myths about mold. And you have so much great content on your TikTok account, Instagram, and YouTube. So for the listeners, definitely check that out because there's such a wealth of information. And I loved, you did like a post about myths about mold. Can you kind of go through some of your key myths?
Yeah, there's so many. I hear them every single day. Just to name a few. One I posted on the other day, which I'm at the Detox Doc. That's my alter ego online. Bleach kills mold, and bleach is good to put on mold. That's not true. Bleach causes mold to release more mycotoxins, and it doesn't penetrate porous surfaces, and it's mostly water. So I don't recommend bleach for mold. Non-toxic products are better instead. Basically just damp cloth with soap, as well as, it depends on the situation, but vinegar, hydrogen peroxide can be useful as
Things they
well.
used back in like the 40s and the 50s
Yeah,
for cleaning
yeah,
products.
exactly.
Yeah.
So, and some essential oils like tea tree is really good for mold anyway, but bleach, no, not bleach. And also, if you don't see mold, then it's not going to be a problem for you in a mold exposure. So, I've already touched on the fact that mold toxins are invisible. They also don't have an odor, by the way. Mycotoxins do not smell. So, even if you don't smell a musty odor, I mean, if you do smell a musty odor, you have a significant mold problem,
I see.
definitely, because if it's enough that it causes that odor, it's definitely a big problem. But even if you're not smelling it, even if you're not seeing it, mold is often hidden. So don't
Where is it
say.
hidden?
So the most common place I would say from working with mold assessors for quite some time now is the HVAC system behind walls, like in the ductwork, exactly like you mentioned. There's also, I mean, in the bathroom and the kitchen, places where there's a lot of moisture and water and humidity. And then also people think that only black mold is dangerous. So mold color doesn't determine the toxicity. So even like aspergillus can be black. That's far and away the most common mold. Aspergillus and penicillium, which are similar and can't really be differentiated on testing in some cases. Even though a lot of aspergillus species are not black, they can be really any color. They put off mycotoxins. And a lot of the toxins that I see on people's testing do come from aspergillus, just for one example. There's so many different molds, but that's just one example. And the amount of mold does matter because, the bigger the exposure, the more you're going to be breathing in, but the color, not as much. Another really big one is that mold is only a problem in old homes. So I mean, there are so many stories and posts that are heartbreaking about people even building a house, going into a new build or building their own home, and it has mold like right away. So even during the building process, and I think about this when I'm driving past half-built new constructions that are being exposed to the elements and they're not using proper materials or things like that, then it can already have mold like when you move in to a freshly built brand new home. So it is not an old building problem. It can be anywhere. It just needs that moisture, even if it was moisture from a while back, it can still be there. And it also just needs that organic material to grow. So, and I think a lot of things we've already discussed can feed into, those myths like people think, oh, mold only causes respiratory symptoms. So that's another big one that we've already debunked, even just in this conversation.
Yeah. I attended a conference a couple months ago, and it was specifically about mold. And I remember being really taken back about the fact that like mold is not choosy. It's mold is happy to go wherever it is, and you could have a new build and think, well, I'm safe. But the doctor that was speaking in that conference had said, well, you have wooden beams. You have a horrible storm. The wood is still a little wet. The next day or two, they come in and put sheetrock up. And so you've got that organic matter that now is a little damp and now it's being sealed, and that's like a breeding ground. And to me, it's like, oh, it's it literally could be anywhere. My house is 20 plus years old. It could be here, but it could easily be in my parents' house that they just built.
Yeah, it's true. It's true. Mold is a survivor and it is very fastidious. Like it will take advantage of any opportunity to grow and put out colonies.
So if you are experiencing some of these symptoms, or if, say, you are in a workplace and you're not feeling well, or you are go to do a project at home and take a wall down and you see mold, what can you do once you have that exposure?
Yeah, so that's great that you mentioned that it can be. I've seen clients who have all of those different exposures, work, school,
Yeah, school.
car, any place. It
A
can even be
car?
your car. Yeah, I had a client who thought that he was out of a mold exposure and he was really into like old cars, and it doesn't have to be an old car, but he did have this cool old car and it was moldy. Like he realized that he had symptoms that were more so when he was in the car, and he was in the car pretty frequently. He had to get rid of his car.
Wow.
Sometimes cars can't be remediated. Depends on I actually put a story in my mold book called Conquering Mold, which is published, that one of the chapters starts with a story about another story about a car exposure from a client who had a drink spilled in a fender bender, like in throughout the car, and it got into the vents, and then there was like mold that grew in there. They figured out after a while of having symptoms, and yeah, it was the car. So yeah, it can be anywhere. I love that you mentioned that. So what do you do? Right. So we need to figure out where the exposure is, if it's a current exposure, or if that gets ruled out, then we can consider it from inflammation from prior exposure, and then how it's affecting your body. So for the home, for testing, I would recommend to get it tested for other indoor environments, even cars. You can test any indoor environment. The best way is to work with a professional. So I am in the ICI organization, and I also work with a mold assessor um, who has his own company and does virtual consults as well. And so we collaborate because, I'm not the home expert. Like, I've worked with them for some time now, so I've picked up some things, but I like to stay in my lane and let the home guys and gals do their thing. So working with a professional, if you can. In some situations, it's not possible, as in a work exposure, for example, but, talk to whoever runs a show at work and see if they can bring somebody in. Ideally, this is always ideal, if someone can come in and take air samples and surface samples. Air samples and surface samples will give a different idea and different pictures of the indoor space. It's really a whole assessment. It's not just about like one test. Like, there's the ERMI test, which is very popular, and it can be very useful because it gives a lot of data on mold species. And so it's really nice if it correlates with the body testing, but sometimes it doesn't. But there are molds that put off like spores that are heavy, so you get them more frequently from a swab, and there are molds that are light spores, so you get them more frequently from air samples. So it's best to, get both if you can, not just like one of the petri dishes. There's like these petri dishes you can set out and have spores, like they'll fall or land on there, and then some mold will grow, and it oftentimes looks really scary, can grow on there. And then you send it off, and I see people posting like, oh, what is this? Is this bad? If you leave a petri dish for long enough, it's always going to overgrow and look terrible. So it really needs to be done with a professional if possible. If you're going to DIY it, which I don't recommend, I do say air sampling is the best to DIY, because ERMIs, like, you can DIY it, but they require a lot of dust.
How do you spell
And
that, Hermes?
ERMI.
Okay.
And there's like other similar tests that are not called that, but that's one of the major ones that's done. And so it's a good test, but a lot of times it's inconclusive because there's not enough dust or things like that. So yeah, I wouldn't say like jump to getting a whole bunch of testing yourself on your place,
Yeah, because
but
I had looked at testing at like a Lowe's or a Home Depot, and it was like a canister of some sort, but it was only for a particular room. So if I
yeah.
checked one room, and I've got 6 rooms in my house, including bathrooms, that alone was several $100s. And then there's room for error, right? Because I'm not a professional. So if you don't know where the exposure is coming from, is it best to start with your home?
That's where I spend a lot of time. Yeah.
Or do you think, when are my symptoms the strongest? So if I'm like, I'm fine at home, but then I go home, I go to work, and by the end of the day I have a headache or I'm congested, are those the type of clues that you should be thinking of to maybe indicate where it could be coming from? Or should you always start at the home base?
Yeah, so usually the home, but if it's clear that there's symptoms at another place, then definitely would start there as well. And then the body testing. So again, there's no perfect test, and I go on symptoms are the most important. Like, I don't require any testing to work with people. If someone has been exposed to mold and they have symptoms that correlate, then we can work together, and I don't require testing. However, there are some tests that are good to figure out which toxins your body is trying to get rid of, which is a urine mycotoxin test. There's a urine and blood mycotoxin test. And usually I'll do urine because it's similar accuracy and much easier. You can do it at home, and it is It tests, the one that I use from Vibrant tests about 29 different toxins. So
Okay.
it's pretty comprehensive, and it breaks it down like toxin by toxin, how much is in your urine sample. So that is, a lot of times really, really interesting. And I've seen results that run the gamut. There could be 13 or more different toxins that are in the high red range, or there could just be a couple that are moderate. It depends on the person. If we know that, maybe you don't, you feel like you're backed up, like you're having a lot of, lymph swelling, or you're constipated, or like you feel like you have those genetic predispositions, or you do, then I'll do the blood one to get more accurate. That one is for antibodies to mold toxins.
Okay.
So
So way more
both useful.
specific.
No, I mean, I wouldn't actually say more specific. I would just say different information because it's antibodies that your body's making against the toxins. The urine tests the toxins directly, but the blood tests the antibodies your body has made against those toxins. So it's just different information. Urine is like more direct. It's like, this is your toxin level in the urine, but blood is also useful, especially in some of those situations where people are just like, yeah, either they've already had a urine one and it was negative and they're like, I know mold is affecting me, then I'll do the blood test. Other tests that can be useful. So we mentioned how mold causes allergies. So allergists or maybe even primary care will do like IgE allergy tests to mold, which that'll tell you if you're allergic to mold. So it's useful to know. It doesn't tell you anything else besides whether you're allergic to mold, which can be useful to know. And then there's something called a urine organic acids test. And that one is how I test for the colonization piece, because that one shows you byproducts, like things being put off by actively growing mold in the body. So if you have any like residual symptoms or sinus infections or things like that, or gut issues, sometimes organic acids testing can be really useful in a lot of those cases, because I can see kind of what the levels of arabinose is one of them, and a whole section of markers on there. And then I'll be able to figure out if we need, why are we doing these tests, to see what kind of supplements and stuff will be useful, because there's different binders that work better for different toxins. And there's different like antifungal supplements and things like that will be useful if you have have high numbers on the organic acids test. Lastly, okay, not to give a whole long list, but there are lots of tests that can be useful. So general labs, I do recommend people get yearly, like your CBC, CMP, just to kind of see, well, number one, make sure we're not missing anything else. And also because mold sometimes can affect those numbers. We want to see inflammatory markers like ESR, CRP, and then your vitamin D can be affected, like to monitor that. Thyroid panel, want to check that. And then there are other panels that are used for the inflammatory response, which in mold, there's something called chronic inflammatory response syndrome, or CIRS, and that is tested for by a certain lab panel. And it's not specific to mold, but it kind of gives you an idea of the degree of that inflammation and how your body has responded to the mold, and whether your immune system is like just on high alert and having a hard time getting over that mold exposure and all those toxins and spores and everything that you were and not to mention everything else that mold puts off, VOCs and other things, and kind of to what degree is your body still suffering from that. So sometimes I'll use those, but it's not something that I'm going to do across the board.
So you're clearly very, very passionate about this. And I know we talked about this before we recorded today, but how did you become a lover of mold?
Oh, yeah. So, lover of mold. So I was a mold mom before I was a mold doctor. So we were exposed to mold back about 8 years ago now at a home in that we were renting in Maryland. And we knew there was mold, but we thought it was going to be okay because the landlord said that they had, cleaned it up and probably put some bleach on it.
I was going to say bleached.
Yeah, bleached it. And they said, okay, it's fine. But all of the members of my family had a variety of symptoms, different symptoms at the time. And my husband was the worst because he already had some underlying health issues. And so when we were moving anyway. So that was good. We moved and we were already planning to move. So we got out of there. And my symptoms, which had been mostly like mental health issues, the fatigue, I had the globus sensation, which is a feeling that something's always in your throat, but it's not like a throat infection. You just feel like there's something there, which is very frustrating because there isn't anything there when you look. Things like that. My symptoms improved upon leaving gradually, but my husband's and also my son's were not improving quite so well. So we got a functional med eval for my husband, and that included a mycotoxin test, the urine mycotoxins, and an OAT test, organic acids. And those were just off the charts. And it just blindsided me because I am an MD and I trusted my medical education to have taught me, a full workup for medical symptoms. And I had no idea that mold could be contributing. I mean, he had other things going on,
Mhm.
but mold worsened a lot of his health issues. And so it took some time for him to get those levels down and to get that inflammation down. And my son, we had to do a little detox for him as well. My daughter, we have two daughters, and one lived in that house, and she was an infant at the time. And I feel like she, from being born in that house, just kind of got like a different start to life. That was, she was colicky and she was more peaceful of a baby when we weren't in the house.
Mhm.
So I feel like she just kind of got a little bit of an inflammatory like start to life in that house. Unfortunately, um, she's like my slightly high strung kid. So I wonder sometimes when I see, stuff that goes on with her, how much of that is
Contributing.
back to, relates back to that exposure in her very early life. So, we had that. And then, so I decided I wanted to include mold in my practice. And I've always been into the natural side anyway, but that didn't go so well. The administration and insurance don't really like dealing with mold. They are not going to cover it. It's not coded for well for billing and stuff. And so they said, well, you really just can't do that here. Even though some of the other doctors were interested, the admin insurance side just blocked it. So I said, okay, I'm leaving. So it took a while to get out because the medical system doesn't really like it when you say that. It was interesting and painful process to get out of the medical system, but I'm glad I did. So now I do mold and gut as well because I learned a lot initially from helping my husband and being his personal chef through all his gut issues, but then helping other people as well. With gut issues was so common. Sometimes it's not related to mold, the gut issues that I deal with people, but can be. So I'm now doing functional. I've been doing that for a little while now, and I love it.
And your theory and approach to wanting to find the answer, the core reason why something's happening to the body is one of the main reasons why I started this podcast, because I think that a lot of people are given medication and you instantly sort of maybe feel relief, but it's not getting to the core of the problem, right? And in this case, it could be a mold exposure. And if I'm taking medicine and maybe it's not making me feel better, but slightly better, it's still not really fixing the end core of the reason. Let's maybe talk about the mold detox process. I had that exposure. I have all these symptoms. I did my home test. I know it's in my home. I did, the urine test, let's say, and it was that my numbers were high. What is my next step?
Yeah, that's what it's all about, healing from this once we figure that out. So my protocols have four parts. So the first part is to protect the body first, always. So to protect our bodies, we need to make sure that we're eliminating that exposure or reducing as much as possible the exposure. So whether that's remediating the area or getting whatever needs to be done to the home or getting out or moving, that has to be decided case by case. And then because if you're there and you're still breathing in all of this mold, even if there's, air purifiers and all that stuff can help filtration and purification of the air. But if you are still in a big mold exposure, then anything I do is just not really going to work.
It would work, but then you're going to get re-exposed again.
There you go.
There was a statement shared at that conference. They said, before you take the mold out of the body, you must remove the mold from the environment. And I thought that was, really stuck out to me, and
Mhm.
it's exactly what you're saying, right?
Yeah, yeah, definitely. And then a huge piece is dietary because not only can you be exposed to mold toxins through diet, just there's so many other things that are in, standard American diet that are just toxic. So a low toxin healing diet is huge for healing, which would be low in grains, not just gluten, but all grains, unfortunately, low in added sugars and low in processed foods. There's not like one healing diet. There are several options, but that is what they all have in common. And then I do use some supplements to help protect the body and boost up the body's natural detox processes because really we're just trying to boost up your body's natural detox processes and take out what's in the way because your body is built to detoxify and we just have to take out what's in the way and boost up sometimes because liver function is not always going to be perfectly normal, so and top shape for all of life. So I do a lot of liver support, things like omega-3s, for example, antioxidants through diet, as well as things like glutathione and melatonin and other antioxidant supplements for energy, like CoQ10. There's so many different supplements that I use, and I do decide it based on symptoms and the toxin results if we have them. And then we mentioned the detox pathways. So basically, that just means that are these body's natural detox systems working properly, which the main piece of that is, are you having regular bowel movements? So
Because that's your number one way to get rid of waste.
yeah. So, I mean, our kidneys as well. But, so if there's any like decreased kidney function, then there's going to be a problem there too. But as far as, far and away, the biggest thing that I work on with people for detox pathways is not even like the lymphatic system. It's mostly just like the colon, making sure that we have good bowel movements. Ideally, you don't want to be having diarrhea, but you also really don't want to be having constipation if you're trying to make sure that you're getting toxins out. And then mobilizing the toxins. So step one, protect the body. Step two, open the detox pathways. Step three, mobilize the toxins. So starting regular movement, exercise, whatever is tolerated and whatever, to the extent that you can do, exercise and some supplements help with mobilizing toxins. And then other detox techniques I'll use and modalities like from red light therapy to sauna to a bunch of others. And then last is going to be binding the toxins. So I find that adding binders a little bit later, not immediately, works the best because if you don't prepare the body for that kind of thing, then a lot of times binders will backfire. So some binders are natural and everything like that, and that's all well and good, but
What is a binder?
so binders are substances that can hold on to toxins and help us excrete them or get them out of the body because they're microscopic, they're super small, and they can recirculate and they can keep going held on to by bile and other things in the body. So we have to break that bond and we have to get them to hold on to something else. And I don't really want to say attach because it's more like, those old toys that were like Woolly Willy, I think it was called, with like the metal, like the filings where you use this little magnetic thing. It's more like kind of like a magnet, but it's not
What was like a
strong.
face? Yes.
And because it can come off, like if you're constipated, for example, like if it's trying to hold on for so long, then it can fall off. So it's a bit, it's a complex chemical reaction there, but that's kind of a good way to think about it because it's not like it really fits, lock and key, but it can come off. So we have to be careful with those because I've seen a lot of side effects from binders, and there's a lot of different substances that will bind toxins. Even certain foods will help bind and get rid of toxins from the body, like broccoli, cabbage, kale, ground up seeds. Well, seeds, ground up is the best because of most surface area, but things like chia seeds, things like flax seeds, like all of these, I like to remind people to include regularly in their diets so that they can have natural binders because food as medicine is always the best. So all these things come into play. Um,
So go over the four again. It was
Protect the body, open the detox pathways, mobilize the toxins, and bind the toxins. And I mean, it's best to work with somebody, a mold literate practitioner, because I mean, DIYing it can work, and that's why I have things like my book. But
Yes, and you said that was called Conquering Mold, right?
yes.
Okay.
But so I do have that available for people, and it gives kind of a general overview, but there's not a cookie cutter protocol that works the same for everyone. While I have some guidelines in there, it's not, oh, do this at this dose for this many days because everybody's different. And if you try to do that, then, or if someone's telling you that there's a protocol that will work the same for everybody, it's not true.
And I feel like also, too, the same way the symptoms affect people differently, the solution's going to affect people differently. I know in the conference I went, they talked about a Herx reaction. So if you have high levels of mold and you're trying to detox them from your body, that could show up as a rash or itchiness. And so those are things, when you work with a professional, you can make sure that you have those things under control. Is that accurate?
Yes, I've definitely seen people, especially trying to DIY it, take, for example, a large dose of glutathione or go get some kind of IV detox thing and then feel terrible. So, and have
And that's because it's like too much at one time for your body to process, which I think goes back to your step one, which is really building the body up and in a way that's naturally going to support the detoxifying. I also, in something that you posted, read about sleep and the importance of sleep to detox. So can you just talk about that a little bit?
Yeah, super important for detox. So while we sleep, our body flushes out toxins, and this is basically from our brains. It flushes out the toxins, but only while you're sleeping. So there's, fluid around the brain, and then that only really flushes during sleep. Throughout the day a little bit, but way, way more during sleep. So it's so important to get good sleep to prevent and treat these mold exposures and exposures to other toxins. And also, we talked about the nervous system, so keeping the nervous system balanced, keeping the mood and mental status balanced, like keeping out of fight or flight is really important for healing. And that's kind of a complex topic, but basically just wanted to mention that, you have to remember the nervous system as well. And I have a lot of posts on that.
Yeah, I think that's when I ran my panels, my vitamin D was off, my thyroid function was off, and my cortisol was higher than it should be. And I was in fight or flight. I was in a very sort of stressful job. That's changed. My health has improved. I obviously remediated my house. And so this mold story really kind of hits home for me. So what about people who don't have mold in their house? What can they do to prevent mold from growing?
So we want to keep the humidity less than 50%. That is one of the biggest things that I can recommend, because under that approximate guideline, if your humidity is like 30s or 40s, then mold will have a hard time growing. Mold grows very easily at higher humidities. So that can be the difference right there between having a big mold issue and not. And of course, if you have water damage or if there's a water event in your home, then cleaning it promptly and getting rid of the water promptly, because mold can actually grow within 24 to 48 hours.
Wow.
It can start growing very quickly. And also, air purifiers can help. HEPA air purifiers can really help with mold and mycotoxins. And then also keeping an eye, a lot of people have places in their homes that they never go, whether it's the attic or, I mean, definitely crawl space or basement, stuff like that. You're not
I'm not
regularly
hanging
going
out there very much.
now. So, making sure to I now go in my attic every now and then just because of being in this field. So kind of just keep in your mind the entire ecosystem of your home, because it's all connected. Even if you have mold only in your attic, for example, it can affect the entire home because it's all connected through the ductwork and things like that. So keep in mind, that you have places in your home that you might not go, but either check them, or at least, open the door and, make sure you don't have any kind of smell going on there. Otherwise, yeah, I mean, just keep mold in mind. I think just know that mold is a possibility and it can affect your health. So if you see, and it's not just mold, right? Bacteria is important in the home too. We're focusing a lot on mold for today's discussion, but of course, bacteria in the home and other things in the home can affect your health as well. So, just keeping in mind that not even just mold, but that your environment can affect your health. So if you're having any health symptoms, then because your regular doctor probably won't even have it on their list, keep it on your list. People should keep it on their list that, okay, well, did I have any exposures like to mold or something else in my environment that correlated like when these symptoms started? Did I have some kind of exposure environmentally wise that could have actually contributed or caused that?
And then you mentioned earlier HVAC systems were a big source of mold. So how often do you suggest people have those cleaned?
Yeah, well, so as I said, I don't like to give recommendations on the home side for stuff like that because, that's not my complete expertise. But I think, sometimes it needs it frequently depending on if you have, the level of humidity, I think would
Yeah.
decide that. If you have a really humid environment, then that can accumulate moisture quickly. Could be on the order of a couple months, but it just depends on, the situation. And those industries are also pretty broken as well. So finding a good HVAC servicer specialist that is really key too in that case because a lot of people won't check thoroughly.
Yeah. I know I specifically, because of the conferences I've been with and because the conversations we were beginning, I specifically asked what was in the vents. And he said, oh yeah, there's tons of mold. But had I not really asked specific, I don't know if that would have come up. And I didn't ask last year and they were there. And this time I knew better. So I think you are your own advocate always. So that's something to keep in mind. Maybe call and find out based on where you live within the United States what's recommended. Okay, so thank you so much. That was so much information. And I would say to everybody listening, if you take anything away from today, let it be that mold illness is a real thing, but so is recovery. So there are answers and people out there and professionals like Diana that are there for you to help navigate that journey. So the journey may feel overwhelming, but with the right information and support, you can take your health back. So don't ignore the signs, trust your instincts, and seek out help where you need it. And remember, healing starts with awareness. So if you found today's episode insightful, let me know. Share with a friend or family. If you have your own personal mold story too, please share that and visit my site, centerlanewellness.com/podcast. And then please check out Diana's website. Like I mentioned, it has so much information. It's www.drstafford.com, or you can follow her on TikTok, on Instagram, or on YouTube for more incredible education on not just mold, but other health issues as well. So until next time, stay curious, stay empowered, and most of all, stay well. Thank you so much, Dr. Diana.
Thank you.
Thank you for tuning in to this episode of Women's Wellness Authority. If today's conversation inspired you, shifted your perspective, or sparked something within you, I'd be so grateful if you'd subscribe, leave a review, or share this episode with someone who might need it the most. Have a story of your own or something you'd like to share? I'd love to hear from you. You can connect with me on YouTube, Instagram, and Facebook at Women's Wellness Authority. Please note the content shared on this podcast is for informational purposes only and is not a substitute for medical advice, diagnosis, or treatment. Always consult with a qualified healthcare provider regarding your health and wellness decisions. Until next time, stay curious, stay empowered, and most of all, stay well. Thanks, everyone.